Well, we're sympathetic to the sheriff's dilemma. We believe that in Summit County we're doing a very good job of keeping people out of the criminal justice system. However, we're not satisfied with the progress that we've made to date. We feel that there's a number of different arenas where we can improve our outcomes, particularly in the jail. We've also looked at services outside of the jail in the mental health system in order to reduce the likelihood that people would return to the jail, keep people out of jail to begin with, and also to get people into treatment. We feel that jail is not the appropriate place for treatment.
But there's 40% of his inmates that are there that he says, some of them granted belong there, saying 40%, and a lot of them he says don't, and he's not getting the help he needs. Is there a way to get him more help, or is it just him feeling that way?
We think that we're doing a good job compared to national statistics. We're not laying, we don't feel that that's something that we want to rest on.
When you say you're doing a good job at what?
We think that, well, the statistics, national statistics show that 18% of people with serious and persistent mental illnesses are in the criminal justice system. Our statistics show that we're probably almost half of that statistic here in Summit County. And having said that, I think that we always feel that there's more that we can do. We've looked at crisis services to keep people from ending up in the criminal justice system and improving our access to treatment. We've looked at diversion programs like mental health courts to try to divert people into treatment rather than into the criminal justice system. And we've also looked at services that will help people to move from the jail into treatment and improving access to treatment and that handoff so that people don't end up back in the criminal justice system.
What about his wish of getting more help inside the jail? Is that even, with the way budgets are now, is that even possible or not?
Well, we've been working with the sheriff to maximize the resources that we have in the jail. We've improved access to medications to prisoners. We've worked with the sheriff on trying to make sure that the individuals who are working in the jail have access to the inmates at the times when they need to. There's a number of things I think we can do to improve efficiencies. I'm not a proponent of throwing money at a situation. I think that we need to maximize the existing resources before we look at increasing resources.
He's saying there's not enough mental health professionals in there to help with the inmates who get out of control, because most of these guys, while they have some training, are not experts in what you all do. So can you get more people in there to help him with that, I guess is what he's calling for, or is that not a reasonable solution?
Well, in the face of the funding that we've received from Ohio through the Ohio Department of Mental Health, we've tried to maintain our current level of services. We've tried not to allow those diminishing funding to impact our services to our priority populations, and certainly people in the jail are one of those priority populations. As to whether we can put more services in the jail, we're evaluating that in the context of how we can efficiently use existing resources.
Because you guys have lost money, haven't you? Have percentages of money that you've get, funding cuts from the state?
Yes, we've received funding cuts of close to 30% in the past year, and we're also right now still evaluating the impact of the governor's budget on services. And right now we're hopeful that we won't have to cut more services, but having said that, I think that we would want to make sure that we keep services intact for people who are, the most needy.
Is he being unfair in any way, do you think? He said that they're not a jail anymore, they're an insane asylum.
I don't think that's unfair. I think that we would agree that people who have serious and persistent mental illnesses need to be in the most appropriate setting to address their treatment needs. Having said that, we acknowledge the fact that there are always going to be people with mental illnesses who end up in the jail somehow they'll end up in the jail.
Is there a place where they should be going more so than the jail, to try to avoid the higher population there?
Well, again, that's where we take a systemic approach. We look at all facets of treatment and care from the point of from the point that they interact with a police officer when there's a call made, making sure that that police officer knows that there are options to get that person into treatment versus into the criminal justice system. So we've looked at different points of intercept so that we can keep people from penetrating the criminal justice system.